Hello students, today I will discuss about restrictive lung diseases and restrictive lung problems. They can be because of intrinsic factors of lung, and then there can be extrinsic factors. For example, thoracic cage disorders like kyphosis and scoliosis, they also restrict expansion of lungs. Then there can be diseases of pleura or pneumothorax or pleural effusion, and then neuromuscular disorders. They can lead to respiratory muscle paralysis. And then there are intrinsic lung diseases. Today we will discuss about intrinsic restrictive lung diseases. So first of all, we will discuss idiopathic pulmonary fibrosis. As the name is indicating that this disease has got no cause, and usually it is common in males, and it is associated with cyanosis, dry cough, clubbing, and end inspiratory bibasal crepitations. Then this so usually this disease has got poor prognosis and treatment is supportive. That is, we can give sometimes a short course of steroid, which can be helpful in some patients while it cannot be helpful in some other patients. And then we can use also anti-fibrotic drugs like pirfenidone with a very limited evidence of benefit. So overall prognosis is usually poor. It is 3 to 5 years, and the patient usually develop cor pulmonale, and we can offer them heart lung transplantation. Then overall, if we discuss all the restrictive lung diseases, they have got similar symptoms and signs. Like patients, they have exertional dyspnea, cough. On signs, they can have clubbing, cyanosis, and features of cor pulmonale like raised AVP, pitting edema, and loud P2. Then on X-ray, we can find different type of opacities either on in the lower lung bases or upper lung bases. Then on spirometry, we find restrictive effect, that is FEV1 over VC ratio is more than zero point 0.7. After that, idiopathic pulmonary fibrosis will discuss extrinsic allergic alveolitis, which is also called hypersensitivity pneumonitis, because there is a type 4 hypersensitivity reaction involved in this, and here the opacities or upper zones of lung, they are basically involved, in contrast to idiopathic pulmonary fibrosis where lower zones, they are first to involve. Now there can be many causes of idiopathic extrinsic allergic alveolitis, it can be because of an allergic reaction to wet hay, which is called farmer's lung, then to secretions of bird, which is called bird Spencer's disease, and to mushrooms, and then to certain molds, and then it can be a hypersensitivity reaction to exposure to some fungus. So what happens in the symptoms, that patient develops high grade fever with chills and rigors, and usually these symptoms they are produced when patient is exposed to the triggers, but when he gets away from these triggers, the symptoms they get better. So the prognosis is overall good. Then we will discuss about sarcoidosis, which is a granulomatous disease, and it's a multi-system disease. It can involve any part of the body, including lungs. So, sarcoidosis, it can involve eyes, it can involve brain, heart, lungs, skin, and joints. As far as the lungs are concerned, we have divided different stages. Like in stage 0, lungs they are totally normal. In stage 1, there is just bilateral hilar lymphadenopathy, and then in stage 2, we have also got some fibrosis in the lung that is produced, and in stage 3, the fibrosis, stage 3 and 4 fibrosis, it gets widespread. So, treatment of and diagnosis of sarcoidosis is a definitive diagnosis is by biopsy, but there are some other supportive tests which help us in diagnosing sarcoidosis. First of all, the multi-system involvement, bilateral hilar lymphadenopathy, then restrictive pattern of the lung disease on spirometry, that is FEV1 over VC ratio greater than 0.7, and then after that, serum calcium level is also high, serum ACE level. All these are supportive tests. Then after that, treatment is usually not given in patients. They usually recover on their own. But if patient has got a brain problem or heart problem, then we have to give them treatment with steroids and immunosuppressants. Then there are certain syndromes in sarcoidosis. First of all, we will discuss about Hereford syndrome, which is a triad of parotid gland enlargement, lower motor neuron, seventh nerve palsy, and uveitis. Then Mikulicz syndrome, which which is the enlargement of lacrimal and parotid gland. Then after that comes Lofgren syndrome, which is a triad of bilateral hilar lymphadenopathy, arthralgia, and erythema nodosum. And this is all about sarcoidosis. Then after that comes another disease which is called asbestosis, which is due to exposure of asbestos. And usually the disease it starts after many years after exposure to asbestos. These can be pleural plaques which are benign in nature, nothing to do about them. Then pleural thickening, again nothing to do about that. Then pleural effusion usually develops after many years, and after pleural effusion we can have asbestosis, which is widespread fibrosis in the lungs, and mesothelioma, which is a malignant condition. So, after asbestosis, we will discuss that what diseases they cause upper lung zone involvement, and what diseases they call low zone involvement of the lungs. So, I have remembered upper zone lung fibrosis by a mnemonic which is called CHARTS. Chart C stands for cool worker pneumoconiosis, H for hypersensitivity pneumonitis and histoplasmosis, A for ankylosing spondylitis, R for radiation, T for tuberculosis, and S for silicosis. So this is all about restrictive lung diseases.